Welcome, dear friends. You are watching Study Family Medicine with Dr. Pratyaksh Verma, and I'm your friend, Dr. Pratyaksh. Since your exams are approaching, so I'm starting this series of 2 to 3 minute lectures daily, where I'm going to provide you valuable nuggets for the preparation of your exams. Remember, friends, the journey of 1,000 miles begin with one single step. So, more than perfection, it is the progress that matters. So keep progressing. Don't be disheartened with your preparation and just walk one step at a time and you're going to make it there. So we are going to start with the last year question paper, October 2023. The first question was asked about the headache. The question was like this. Mrs. Shakila, who is a 30-year-old female, works as, just a second, works as a clerk in the government office. So 30-year-old female works as a clerk in government office. She presented to your OPD with recurrent headache for past 2 years, 3 to 4 episodes per month, associated with nausea and occasional vomiting. Now, there are different parts of the question. You have to read the question properly and stick to what the examiner wants from you. So, the patient has recurrent headaches for 2 years and 3 to 4 episodes per month. The first part of the question, what is the cause of her headache? Then the examiner is asking how will you evaluate her? Then how to classify the headaches? What are the common causes? What are the two drugs that cause headache? And what are the red flags? Remember friends, you have just 3 hours and you have 10 questions to answer. So unless you stick to 15-minute rule, you have to answer each question in 15 minutes. It will be difficult for you to make it. So from the history, it is evident that the cause of Shakila's headache is most probably migraine. Why? Because she has recurrent headaches, she has nausea and vomiting, and it is a chronic disease because it has been around 2 years and 3 to 4 episodes per month. So it is the diagnosis is most probably. So you are going to write the possibility or differential like the possibility or probability of the diagnosis. You are not going to write the final diagnosis. Okay. So migraines are often characterized by recurrent, unilateral, and pulsating headache associated with nausea, vomiting, and sensitivity to light and sound. Just write this much is sufficient. You don't have to fill the whole pages. Remember, you are going to get just 5 pages per answer. 5 pages per answer. For one question which has 4 parts, you are going to get just 5 pages. So try to write relevant bullet points and wherever possible, make flow charts. Don't write in paragraphs like this. This is a very good answer, but you don't have to write in paragraphs. Remember to write in bullet points and underline wherever necessary, just underline. And when the examiner is asking approach or evaluate, just think of it as a new patient approaching you. New patient approaching you. Now, what are you going to do? You are going to ask an history. You are going to examine the patient and you are going to do the tests, right? So, right in under evaluation, you have to ask detailed history. In the history, write these points in bullet points. From how much duration the patient has headache, what is the location, what is the intensity, whether it is severe, so that the person cannot even carry out the normal physiological daily activities. And what is the quality of the headache? Quality means whether it is pulsatile or diffused, and whether it is associated with the symptoms like aura. Aura is when the light breaks, visual disturbances, triggers, whether there are some triggers to it. For example, sometimes when you're hungry, the headache triggers, or when you are stressed. Usually, the stressed people get these. Stress is usually the trigger for such kind of headaches. And what are the relieving factors? Whether it relieves with taking rest or uh, taking some medication. Then you have to examine the person physically. You have to look out for any focal neurological deficits. If there are there, then you have to urgently go for some imaging modality, like some CT or MRI scan, to rule out whether the person is having some uh, some tumor or vascular causes of the headache. Okay. Now, next question is, how will you classify the headache? And what are the common causes? Remember, family medicine is about a generalist approach. Generalist. Although the examiner is asking you a question of neurology, but he knows that you are not a neurologist. You are a generalist. So you should know everything. You should be aware of everything. And you should have just the broad ideas. The broad ideas. And if you are aware in depth, then that's really great. But if you are not having a broad idea, then you're going to definitely struggle with the profession and also the exam. So how will you classify the headaches? Now, uh, the question is just of 3 marks, and you have to write in proportion with the marks also. So remember that. Write relevant and write to the point answers. Examiner is not expecting you to fill the whole sheets. Examiner is there to pass you. You just have to write relevant. So there are two major causes of headaches. First one is the primary headache, and the second one is the secondary headache. The primary causes are migraine, tension type headache, and cluster headache. How is migraine presenting? Recurrent, throbbing headaches with nausea, photophobia, and phonophobia. Then tension type headaches, it usually is both bitemporal and frontal region, bilateral, tightening pain, band around the head, right relevant. Then there is cluster headache. The cluster headache is severe intensity unilateral headache. So remember this. Cluster headache is unilateral. Tension headache occupies both the sides, and migraine is usually throbbing. In the cluster headache, there is also the tearing of the conjunctiva, and the pain is so severe that the patient often lacrimates from one side and has nasal decongestion. Then there are secondary causes of headaches. The secondary causes are sinusitis, usually due to trauma, infection, tumors, or there might be some causes of fever. See, the thing is, secondary causes are which is in which the causative factor can be relocated, means to these modalities. For example, in sinusitis, it is usually the infection of the sinuses. Then there is trauma, hypertension, tumor, and other causes of fever like meningitis and encephalitis, in which the intracranial pressure rises. Then two drugs that cause headache. We all know that nitroglycerin causes vasodilation and causes headache. And then there are the drugs which modifies or modulates the hormones in our bodies, like oral contraceptives in females usually. They are also associated with headaches. They usually, the female hormones usually also vasodilates the blood vessels. What are the red flags in history and physical examination of headaches? So remember the red flag sign. These are the signs where you have, why the examiner wants to know this? Because now you have to refer the patient to a higher center or to a specialist. Here is where the need to refer is there. So if the headache is sudden onset or thunderclap headache, the patient usually tells that it is the worst headache of my life. Now you have to evaluate further for subarachnoid hemorrhage. If the headache is new or different in patient older than 50 years, now elderly patients also are prone to falls and which may cause extradural hematoma in such patients in elderly. So uh, then you have to rule out temporal arteritis also in elderly patient or some mass lesion. Whether there is focal neurological symptoms or signs, for example, in stroke or brain tumor or aneurysm. I think if you explain this much, then the examiner is definitely going to give you good marks. Remember, friends, challenges come in your life to upgrade you. Do not be afraid of failure and do not see. We all work for success, but the thing is, we all must work to upgrade ourselves, and this is the best time to upgrade yourself with the help of the challenge that you are facing in the form of exam. So, all the best. I'll keep visiting you daily. See you.